Cardiopulmonary resuscitation, CPR, and the basics of fluid therapy and parental feeding. So discuss the indications for CPR, the post-CPR assessment, reversible causes of cardiac arrest, cardiac pulmonary critical patients, and things to consider before CPR. And basic life support, A, B, C, D, E, F, airways, breathing, circulation, drugs, ECG, and fluids. For fluid therapy, discuss fluid homeostasis, estimating dehydration, and examining hypovolemia. For infusions, discuss crystalloids, which are small molecular weight. They can be isotonic 0.9, hypotonic 0.45%, and for hypertonic, give it 10% injection. For colloids, they have a large molecular weight and they could be synthetic or natural. And also discuss parental feeding. TPN, which is total parental nutrition, and PPN, which is partial parental nutrition. So the indication of cardiopulmonary resuscitation is cardiac arrest or cardiorespiratory arrest. The clinical signs of cardiac arrest are gasping or agonal breathing patterns, unconsciousness, lack of spontaneous breathing, lack of palpable pulse, and lack of cardiac sounds. The prognosis is poor. Less than 1% survive till discharge. The causes of cardiac pulmonary arrest can be hypovolemia or hemorrhages, hypoxia or hypoventilation, hydrogen ions in the case of acidosis, hyperkalemia or hypokalemia, and hypoglycemia. In the case of cardiac pulmonary critical patients, common patients are SIRS, systemic inflammatory response syndrome, septicemia, congestive heart failure, ARDS, which is a severe respiratory disease, cerebral diseases in the case of seizures, multiple trauma, and coagulopathies. And things to consider before resuscitating an animal are the underlying disease, the owner's will, the timing, whether it's within 3 to 5 minutes of a cardiac arrest, equipment, and trained staff. So you need at least 3 nurses. So basic life support, A, B, C, D, F. So airways. Clean the airways of mucus, foreign bodies, and you can enter endotracheal intubation. For breathing, you can use a balloon and you can have a rate of 10 to 12 breaths per minute. For circulation, for the thoracic compressions, have the animal on the right lateral recumbency, and the position of the hands depends on the size of the animal. In a medium or large animal, both hands have to be on the widest part of the thorax. In a medium animal, the hand has to be over the heart on the 4th to 6th intercostal space. And in a small animal or a cat, have one hand over the heart and thump the other side of the chest. The drugs can be given IV or intratracheal. The safe drugs are atropine or epinephrine or lidocaine. However, adrenaline can cause peripheral vasoconstriction, which increases cerebral and coronary perfusion. Atropine increases heart rate, increases vascular resistance, and increases blood pressure. It is the most effective in the case of vagotonia-induced systole. On the ECG, so you can see the background, whether it's asystole or electrical activity without a pulse. And you can also detect ventricular fibrillation and severe sinus bradycardia. In the case of fluid therapy, in patients with hypovolemia, so you give the shock dose. So for crystalloids, in a dog, it's 90 milliliters per kilogram, and in cats, it's 45 milliliters per kilogram. In colloids, you give 5 milliliters per kilogram in dogs and 2 to 3 milliliters per kilogram in cats. For fluid homeostasis, so hypovolemia is the lack of fluid in the intravascular space. So there's a lack of perfusion or oxygen to the organs. Dehydration is a lack of fluid in the interstitial and intracellular space. To examine and estimate dehydration, look at the history. Is there anorexia, hypodyspnea, vomiting, or diarrhea? Is there dryness of the mucous membranes but still salivation or nausea? To grade the dehydration, less than 5% cannot be detected. 6% you have tachy mucous membranes. In 8% you have decreased skin sugar. And in 10% you have enophthalmus. In 12% you have persistent skin tenting and a cloudy cornea. And in over 12% you have hypovolemic shock and death. For examining hypovolemia, look at the perfusion parameters such as PCV and TP, but also look at the color of the mucous membranes. Make sure they're not pink, they should be pale or red. Look at the capillary refill time, it should be less than 2. The heart rate should be around 140 beats per minute, and there should be no jugular vein distension. The types of infusions. Crystalloids are a small molecular weight compound, such as electrolytes and glucose. Isotonic is 0.9% saline. It can also be Ringer's lactate and serifundin and salsol A. Hypotonic is 0.45% NaCl, and it can be salsol B as well. And hypertonic is a sodium chloride 10% injection. Colloids are a large molecular weight compound, such as starch and proteins. You can have synthetic, such as starch, which is HAES, or you can have natural, such as human albumin, or blood products, such as plasma. In acute fluid therapy, the goal is not the amount administered, but to normalize the vital signs. The first choice is isotonic crystalloids, such as lactated ringers. So 50 ml per kilogram in a cat and 90 ml per kilogram in a dog. You can also give colloids, such as HAES. In chronic fluid therapy, this is to correct dehydration. It depends on the conditions of the patients and the lab results. Isotonic crystalloids are mainly given, such as Ringer's lactate and ringerfundin. They're mainly given if an animal's not eating or drinking. Or when animals are in cages for a long time, they can have daily fluid losses in the urine, feces, and panting. So for maintenance, you can give a hypotonic solution, as it distributes in every compartment, the cell, the interstitium, and the intravascular. It cannot be applied in bolus, for example, serifundin B. It can also be given in the cases of ongoing diarrhea, vomitus, or polyuria. The complications of fluid therapy can be overhydration, weight gain, serous nasal discharge, restlessness, and jelly-like subcutis, tachycardia, coughing, and ascites and tachynoa or dyspnoea. There can also be venous catheter problems, such as a paravenous infusion, thrombophlebitis, and infection, which can lead to septicemia. When discontinuing fluid therapy, you gradually decrease by 25 to 50% per day. And give information to the owner, for example, oral rehydration solutions. Parental feeding is done if tube feeding is not possible. So if there is a non-functional distal small intestines or large intestines, or if the animal is unable to tolerate tube feeding, we can still prevent malnutrition. Total parental nutrition, which is TPN, is given to 3 to 14 days. It totally meets nutritional requirements and it has a low osmolality solutions. It's given on a peripheral IV line. Partial parental nutrition is given under 5 days. It partially meets the nutritional requirements. It has low osmolality solutions, and it's also given on peripheral IV lines. The disadvantage of total parental nutrition are thrombophlebitis, metabolic abnormalities, and sepsis.